The dialysis catheter under the collarbone it's a procedure which typically lasts about 45 minutes to an hour. Is done either in access centers or in the hospitals. They numb the skin and they place the catheter. The catheter is actually available for use immediately. One of the caveats of having that, what we call as a tunnel dialysis catheter, is that the dressing has to be kept clean and dry, and we cannot take a shower. That's why we like to avoid having a tunnel dialysis catheter. And a lot of our patients who are approaching stage 5, like they are still in stage 4, we refer them to a vascular surgeon. So what a vascular surgeon does is that they surgically connect one of the veins in the arms, either below the elbow or above the elbow, to the artery. So the artery is the tube of blood which is carrying the blood from the heart. The heart is the pump, and the blood is coming and then it goes into the vein back to the heart. The vein, getting this high pressure blood, becomes dilated, gets a little bigger, and it takes about 6 weeks to get bigger. And that's the portion of the fistula that we can use for hemodialysis. It's important to get to see the vascular surgeon, because the first visit that you have is what we call as the consultation, and then from that time then the surgeon's team schedules the procedure for the surgery. Occasionally they may need clearance from your lung doctor, heart doctor, or primary care doctor to get the surgery done. So that can also take time. And from the time you actually have the surgery done, it typically can take 6 weeks. One is a fistula. The other one is that occasionally when they don't find good veins, they can put in what is called as a graft, arteriovenous graft. So a graft is like a rubber tube which is used to connect the artery to the vein. And sometimes they are available for use sooner than the fistula. But both of them do the same thing. From a kidney doctor's perspective, we find the fistulas are longer lasting, very seldom, if at all, get infected, and just serve our patients better. So we prefer fistulas, but for the patients who can't get a fistula, sometimes the vascular surgeon will place a AV graft. And once the AV graft or fistula is ready for use, then the patient can get hemodialysis from it. For our home hemodialysis patients, it's not a big deal for them or their caregiver to learn to cannulate the AV fistula or the graft. By cannulation, I mean placing the needles, because we have a numbing cream which, if you put 30 to 60 minutes before your fistula is cannulated, then the skin becomes numb and then it works out. The best part of having a fistula or a graft is you don't have a catheter. So you can go swimming, you can take a shower, get into the pool, depending upon where you're living and how much of a wait time it is to see the consultation and then get all your clearance for your surgery. This all needs to be planned well in advance. So you may notice that your nephrologist is wanting you to get a fistula or asking you to get a consult done while you're still in stage 4. In order to get it done in a timely manner and to avoid placement of a catheter under your collarbone, we just need to get the ball rolling a little bit sooner. Because if we don't, we do see patients who start going into stage 5 and start having complications of untreated kidney failure. And then at that time, the only option available is to put the catheter under the collarbone. So just because you have a mature fistula doesn't mean that you're going to get on dialysis sooner than you should. But it does keep you out of the hospital. It does keep you from having an extra procedure.